Good afternoon and welcome to everyone. Thank you for joining us for another insightful clinical meeting organized by the Gurukul Global Academy. I am Dr. Neha Matre, MD in Kai Chikitsa and a proud member of the Gurukul Global Academy. This academy is not just an institution, but a dedicated platform for advancement and upgradation of Ayurveda. At Gurukul Global Academy, every course and every program is designed to help Ayush doctor to grow in skills, knowledge, confidence, and to become expert who are ready to serve globally while staying connected to our traditional roots. Let us celebrate today's Dhanvantari Jayanti by embracing the wisdom of Ayurveda. May Lord Dhanvantari bless us with strength, knowledge, and wellness. Now, as a mark of reverence and unity, let us prepare ourselves for Dhanvantari Stavan.
नमामि धन्वन्तरीरादिदेवं सुरासुरवन्दितपादपद्मं लोके जरारुक् भयमृत्युनाशं दातारमीशम् विविधौषधीनां शङ्खं चक्रं जलौकान् दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुदंशुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन् प्रौढदावाग्निलीलं
Thank you. Now, I invite Dr. Datta sir to continue further with today's session and guide us ahead. Once again, a very warm welcome to all, and I hope this meeting will be fruitful for everyone involved. Thank you.
Thank you, Neha Madam. I welcome you all on behalf of the Gurukul Global Academy. We have on mission that is building the future of healthcare. We are providing 25 plus super specialty course in Ayurveda with the integration of Ayurveda and modern science. We do clinical meetings twice in a month. We will be having workshops and hands-on training plus conferences regarding with Ayurveda and modern science. You can email us on thegurukul@parasnathclinics.com. You can also visit on our website, that is thegurukulglobalacademy.co.in. If you have any issues or any queries, please WhatsApp on this number, that is 9969119134. We have a WhatsApp group. Please join us on this WhatsApp group by just ping hi to this WhatsApp number. Please join on today's clinical meeting on the auspicious occasion of Dhanvantari Jayanti. Our today's eminent speaker is Dr. Nithin Kochaar sir, and topic is evidence-based management of cancer by Ayurveda. It is my honor to introduce sir, Dr. Nithin Kochaar sir, BAMS MD Ayurveda. Sir is a senior Ayurveda consultant for cancer and chronic diseases, practicing in Mumbai since 1995. Sir is ex-honorary consultant at KM Hospital, Parel, Mumbai, plus honorary consultant at University of Mumbai and KG Mittal Punarvasu Ayurveda Hospital, Mumbai. Sir is teaching faculty to MSc integrated students. Sir also has a research background. Sir has worked as a Ayurveda co-investigators in various clinical trials at Tata Memorial Cancer Hospital and Research Institute on safety and efficacy of curcumin, ashwagandha, and cannabis in osteosarcoma, breast cancer, head and neck, and lung cancer. So I welcome sir Over to you, sir.
Thank you very much, Dr. Datta. And I'm indeed thankful to Gurukul Global Academy for giving me an opportunity to interact with you all and to share my views on cancer. And let us join hands so that we all can fight this dreadful disease and make our society disease free, which I feel is possible if we add Ayurveda treatment to the current conventional line of treatment. Okay, now let me share it. Okay, I hope you are able to see my PPT.
Yes,
Is
yes,
it
sir. Yes.
visible? Yeah.
Yes.
So, evidence-based management of cancer by Ayurveda. Honestly speaking, when I say evidence-based Ayurveda, yeah.
Sir, can you just make it big?
Just a
Just
minute.
down the slides, right one. Yes.
So, Ayurveda Shastra itself is a Shashwata Shastra. So, I am Ayurveda Shastra Shashwato Nirdishyate. Anaditvat स्वभाव संसिद्ध लक्षणत्वात भाव स्वभाव नित्यत्वाच. त्याला आपण एव्हिडन्स बेस्ड काय म्हणणार? The Shastra which is existing since time immemorial. The things which are principles which are described in Ayurveda are existing in nature. They are not generated in laboratory. That's why it is called Swabhava Samsiddhatvacha. Means the sweetness of the cane juice, sweetness of the fruits, the sourness of the lemon, the spiciness or the pungentness of the pepper, the bitterness of the karela, etc. All these things are inherent properties. They are not generated by human beings. So that's why it is called Swabhava Samsiddhatvata. And Bhava Swabhava Nityatvacha is another word which Acharya has said at last. It means these properties are going to last as long as the universe is going to last. So this Shastra is Shashvat because of this Anaditvacha, Swabhava Samsiddhatvacha and Bhava Swabhava Nityatvacha. It has documented 4,000 years or 3,000 years before just from now. Okay, and we come to know about all these principles because of the Tapodhyan of Charak and Sushruta and our Rishi Munis. They have rediscovered these properties and they have mentioned in a readable form. So when we talk about cancer, let us understand what cancer means and how we can treat it by Ayurveda. Though our Shastra is Shashwat, we need to support it by modern practical evidences. Okay, within the frame of principles of Ayurveda. This is my main focus. I don't want to violate, I don't want to dilute any of our principles of Ayurveda. So I have tried my level best to prove, everything, though by modern science, but within the frame of Ayurveda principles. I must thank my teachers, late Vaidyashri Lataji, Gordia ji, HP Sharma ji, Dr. Rakesh Sharma, Vaidya Ranawat, Ashish, my friend Ashish Vishwajit Patade, Nithin Gordia, Hina Bhatt, my Gorega Medical Association colleagues, my family members, my patients, and above all, Lord Dhanvantari. And I'm so grateful to you for giving me opportunity on this Dhanatrayadashi to speak on this. My all modern doctors, my Guru, Dr. Devchand Gala, late Dr. Ashok Vaidya sir, Nilima Sagar, Nirmala Rege, Dr. Banavali from Tata Hospital, Manish Agarwal, who has given me an opportunity to work in Tata Hospital on osteosarcoma in 2005. And since then I am working. Dr. Pankaj Chaturvedi, Shalaka Joshi, Vikram Gota, they are working in Tata Hospital at a professor level and associate professor, HOD. So with them, I had an opportunity to work on cannabis. Dr. Lal Hingorani, he has provided me a good amount of standardized herbal medicines. Dr. Manu Lopas, he's from university, with whom we have worked on gold nanoparticle. And Datta, I will always and strongly recommend to conduct a lecture, organize a lecture of Dr. Mitali Mukherjee. She is IITN from Jodhpur, and she has phenomenally worked on Ayurgenomics. She has proven everything. So, I'm really grateful to her also for, decoding Ayurveda. And Dr. Sayyid Tahir Hussain, last but not the least, who taught me about cannabis. So these are the list. These are all bibliography from all references I have taken for this presentation. So if you all like it, all the efforts are good people, and if you don't like their shortcomings, they are because of me. Now, why to treat cancer? by Ayurveda. What is the current scenario? So current scenario, friends, almost 1500 death per day. This is American Cancer Society. Though the death rate is little reducing in America because of the early diagnosis and aggressive treatment. In India, death rate is same. Probably it is more because non-documented deaths are more. So I would say 2000 deaths per day. This is our National Institute of Cancer Research Project India. This is the data. The surprisingly 90% of the death in cancer is not because of the primary disease, but it is because of the spread, because of the relapse, because of the metastasis, because of the drug induced complications, so on and so forth. So there is a big lacunae. There is a big field, in which we have to work, that we have to prevent this 90% of the death. Okay, let me so these are the things. We say that chemotherapy, radiation, immunotherapy, they are useful. Yes, they are useful. But chemotherapy is a double-edged sword. It kills cancer, but at the same time, it also promotes cancer, progression. This is from the journal Seminars in Cancer Biology 2020, Paradoxical Effects of Chemotherapy, what you are able to see on your left-hand side. So chemotherapy, at the time when it kills cancer cell, it also promotes cancer stem cell generation, CSC. Okay, so bone marrow is stimulated to produce cancer stem cells more. 80% of the cancer cells, they die because of the chemotherapy, but remaining 20%, they don't die and they become resistant to chemotherapy. They become stem cells. They generate more and more cancer cells. Okay, then chemotherapy also changes the vascular permeability, because of which these cancer cells, they are able to enter into this vascular system. They travel into the body, extravasate, and they locate themselves in a weaker part of the body. Chemotherapy weakens our immune system. Chemotherapy spoils the environment of the human body. So this is what we call tumor environmental factor. So chemotherapy actually, makes our environment tumor friendly. So these are the prominent side effects. So tumor favoring inflammation is increased, because of which metastases are increased. Cancer stem cells are increased. They circulate in the body and they come out of the permeable blood vessels and they themselves locate themselves in other part and what we call metastasis. So though chemotherapy is mandatory, let me be very clear, I am not against chemotherapy or radiation, but one should also look at this. Last 1 week, I had 4 patients. They have completed their chemotherapy in the month of December or Jan. But again, there was a relapse in the month of April, May, June. Now what? Next what? The next line of chemotherapy is to be planned, or some immunotherapy is to be planned. The cost, the side effects, there are so many things. So if we are able to convince our government and convince the conventional treatment authors, you add this Ayurveda treatment, which we are giving you evidences in your languages without violating our principles. We are giving you safety profiles of the herbs and the protocols we are going to use. So why don't you start this Ayurveda medicine as a onco preventive or as a chemo preventive, so that this relapse and spread and metastasis do not occur. Our herbal medications, we should assure them that it will synergistically work with the chemotherapy. It will not obstruct, it will not dilute, it will not abrogate the efficacy of chemotherapy. So if we are able to generate the confidence by giving practical examples, successful examples, then I think one day Ayurveda treatment will be added to conventional line of treatment as a fourth pillar called onco-preventive treatment by Ayurveda for cancer. And I'm indeed thankful to Guru Krupa Global Academy and Dr. Datta, for organizing such lecture. I will try my level best to be, give you in a simplified manner so that we all can use it. Alone Dr. Kochar won't be able to, reach to so many people. If you all join our hands, if you all do together in a one way, in a one protocol method, then definitely, we can give the good contribution to the society. So this is the reference. I have given you all the references. You can also go through it. Okay. So whether chemo prevention is a legal word allowed? Yes, it is allowed. In 2001, the Lancet Oncology, one of the best journals, and again this chapter, this article was repeated in 2005 or 2010, that chemo prevention is the need of cancer treatment. It means the treatment which can arrest the initiation, growth, and proliferation of the cancer. That is called chemo prevention. Chemo prevention does not mean chemotherapy prevention. Don't misunderstand, don't misinterpret. Onco prevention is the right word. So, in Ayurveda, what we say, Anuhi bhutva prasamam rogam paschat vivardate, sa jata mulo bhutnati brahmayushcha. So, diagnosis first, very important. Diagnose at the earliest Anu stage. For that, let us be open. Let us understand modern investigation. Let us accept it. So, that will also add on to our treatment and outcome. Okay. Later on, you keep on giving the treatment. So, the Lancet has given a beautiful pyramid. Those who are high risk individual and healthy subjects, give them primary chemo prevention. Give them a dietary changes. Make a good dietary changes. Ask them to quit tobacco, alcohol, sugar, salt, excess milk. Let us see how they respond to it. Then second level of the pyramid is patient with pre-invasive dysplasia and patient with pre-neoplastic lesions. Add on some drugs to this patient, Ayurveda medicines. Okay, and let us see how they respond to it. Now, third level of this, those who are treated and still there is a doubt that they are high grade cancer and there are again chances of relapse. So you continue the line of treatment which you had given in the second step, or you can make little aggressive. You can use safer rasa ushadhi, which are standardized, which are proven that there are no organotoxic side effects. Add on that. Okay. So if you do in this way, I think we can achieve the goal of chemo prevention or onco prevention and the metastasis and the sad demises of so many people. So these are the pyramid. Okay. Now the question is asked that are we allowed legally? Yes, you are. So WHO former Director General Dr. Margaret Chan, she said traditional medicines of proven quality, safety and efficacy, they contribute to the goal of ensuring all people have access to care. So you should have a herb or molecule which is standardized, which is safe, which you have proven safety and efficacy in various clinical trials. So with this, you can with more confidence, you can stand. There are so many doctors, modern doctors, they are against Ayurveda. They are doing verbatim in various, the podcast, their podcast and YouTube. So let us not abuse them. Give them answer with the substance. Prove your herbs, okay, in various whatever best possible laboratory or clinical examination without violating principles of Ayurveda. I'm always saying that, and prove the efficacy, and then let us see. So this is the WHO strategy for 2014 to 34. Yes, you should do it and you should take advantage of it and add Ayurveda medicines to cancer patients. Okay. So I am solving your issue of, legality also. So now my topics will be integrated understanding of cancer pathology, then clinical trials at Tata Memorial Hospital, and also my own personal clinical experiences. So friends, causes of cancer, when we see we all say, oh, it's genetic. No, it is not genetic. Genetic is hardly 5 to 10%. 90% of the cancer are because of the environment. Now, when I say environment, it doesn't mean the atmosphere around you. It is not because of the garmi or thandi. The environment means there are factors like your diet, smoking, alcohol, obesity, infectious diseases. Okay. So all these things come under the heading called environmental factors. So 90% of the cancer is because of this wrong environment. Person is obese. The cancer chances are increased by 35%. Person is having irritable bowel syndrome or grahani, again the chances of cancer is increased. Person is depressed, cancer chances are increased. Okay, infectious diseases, cancer chances are increased. Only 10 to 15% of the patients, they actually have genetic origin. So rest of the 90, this is very important step to understand. 90% are because of the wrong environment. Hetu, most important. So this is the hetu. Okay. So wrong diet is important hetu, and wrong lifestyle, again, very important hetu. So once we get the hetu, we can definitely treat it effectively. Ayurveda, it has been documented 500 before the Christ, 500 years before the Christ, that cancer is a low-grade inflammatory disease due to improper or no panchakarma, no shuddhi, prolonged fasting, prolonged illnesses, बल कमी झालाय त्याच्यामुळे कॅन्सर वाढू शकतो. Excessive salty, sour, heavy food. स्थौल्य is written that it is the causes of cancer. Grahani, IBS, or any inflammatory bowel disease. Injury to vital organs like marma, abnormal deliveries. Okay, specific Sanskrit word is used for that. Okay, multiple abortions and low immunity. So these are exactly same factors which modern science is also accepting. So now we come at par that yes, about the etiology, what Ayurveda says and what allopathic says is correct. Now, when we say genetic, let me, one shlok is there. Yasya bija bhaga avavayasya dushti bhavati tasya bhagasya rogaha bhavanti. I may be a little wrong in the Sanskrit, but this is from Charak Sharirsthan, 2nd or 6th Adhyay, Charak Samhita. So there is a reference of genes in genetic diseases in Ayurveda. Now the funniest part, even if a cancer susceptible gene is present in that person, it doesn't mean that he will or she will develop the cancer unless this environmental factor supports that gene. Okay, so it's a very strong etiology factor, diet and your all other factors, etiological factors, which you can modulate. They are modifiable. Genetic is not modifiable, but you can definitely target epigenetics and you can control that by proper diet and proper environmental factors. So genetic stimulus will not be able to proliferate cancer cell. Okay, so this is about causes of cancer. The journal reference is Pharma Research 2008, and this Ayurveda reference I have given. Okay. Now, these are the further journals, DNA mutation may not be the cause of cancer. Even modern people are also, they are accepting it, that cancer is, yes. Then what is cancer? If it is not a DNA mutation, genetic, then cancer is a metabolic disease. Now, when I say genetic disease, I become a little nervous that I am not able to treat genes or difficulty to approach genes. But when I say cancer is a metabolic disease, it becomes in my hand. I can treat that disease. Probably I can cure the disease because I can easily target the metabolism. So this is what these journals are saying, that cancer is not a DNA mutation, may not be. Okay, cancer is a metabolic. So first triggering factor is metabolic abnormality. This metabolic abnormality triggers DNA, and then from that onward, the cancer process starts. So we can definitely first, and why this is so? Because even treating patients, why there is a recurrence? Because we are not addressing the basic root cause is metabolism. Okay, so one has to consider that metabolic problem, metabolic pathology is a basic driver and DNA is a passenger. DNA mutation is a passenger. Okay, so this one has to keep it in the mind. Now, let us understand what is the metabolism. Whatever food you consume, normal cell converts that glucose to glycolysis. Whatever glucose, complex glucose broken down into the intestine and it's reached to your your cells. It is broken down. Glycolysis happens. 2 molecules of pyruvate followed by acetyl coenzyme A. This acetyl coenzyme A enters into mitochondria. Okay, the metabolic unit or cellular powerhouse. Here, through 10 steps, this acetyl coenzyme A, okay, along with the help of oxygen, is oxidative phosphorylation occurs. Okay, and thereafter the substrate is transferred to electron transport chain, the NADH and FADH, the final outcome of Krebs cycle. They are NADH and FADH. They are transported to electron transport chain, which are present in the external membrane of your mitochondria. Okay, And here there are 5 molecules are there, external transport chain, and NADH or FADH, ultimately there is a generation of adenosine triphosphate, that is energy, and there is a production of raw material, fatty acids, amino acids, nucleic acids. So this is the basic physiology which we all have read in first year or second year. Okay, so catabolic pathway from the food produces 40 molecule of ATP. 1 gram of, for example, 1 gram of glucose, it gives 40 molecules of ATP. It also produces heat. It also produces water, carbon dioxide, and reactive oxygen species, that is free radicals. Through anabolic pathway, the glucose molecule or food or protein or fat, whatever you have consumed, is converted into substrates for biosynthesis for organelle and membranes, like fatty acids, like amino acids, okay, like nucleic acids. All these things are produced as an anabolic pathway, and these raw material are used by the cells to proliferate and to make newer generation, to give birth to newer cells. Am I clear? Am I clear, or is it too complicated?
Clear, sir.
Okay, very good. Thank you. So there are 2 pathways, catabolic and anabolic. Catabolic produces energy, 40 molecules of energy and heat and water and carbon dioxide, and anabolic produces raw material. Now, what happens exactly is, whenever this mitochondria is damaged, your Krebs cycle is disturbed, your ETC is disturbed. So there is a reduced oxidative phosphorylation. Now you need energy. So what body will do? Body will send this acetyl coenzyme again to the cell, from mitochondria to cell. And there again aerobic glycolysis happens. Though oxygen is there, it stimulates aerobic glycolysis. Okay. So there is a fermentation. In this pathway, there is a reduced amount of production of ATP. In previous, we have seen that 40 molecules of ATP are produced by one glucose. But here, only 2 molecules of ATP are produced. And lots of raw material is produced through increased anabolic pathway, like pentose phosphate pathway, glutaminolysis. Because to produce that 2 molecule of ATP, okay, your cell doesn't have that much of the efficiency what mitochondria and Krebs cycles are having. So they have to churn a lot. So substrate production is more. Upadhatu production is more. Dhatu production is less. In Ayurveda terminology, if I say, one धातु से दूसरा धातु जब बनता है, तो उपधातु का प्रोडक्शन, मल का प्रोडक्शन, एंड जो अगले धातु का प्रोडक्शन है वो होगा. So if Agni is man there, upadhatu, mal will be more and dhatu will be less. So this is the same concept. There is an excess amount of, this fatty acid and lipid, and they are produced. They are not healthy. And a lot of, lactic dehydrogenase is produced, LDH, which is like a fermented product. Now, this LDH will surround that cell and will not allow the immunity to kill or wash out that abnormal cell. So this is the basic pathology, the damaged mitochondria. Okay, because of which there is a reduced amount of ATP production and excess amount of upadhatu or substrate production. Okay, this is exactly, happens. Now, cancer cells, they smartly use this excess amount of fatty acid, nucleic acid, amino acids for their proliferation. Let us see how. Now, when nucleus and mitochondria, they are in talk with each other. The cell of the mitochondria and the nucleus gives signal to the mitochondria that I need 10 grams of fatty acids, I need 10 grams of amino acid, for example, and I need so much of the energy. So mitochondria receives this message, processes and produces the material and energy, and again tells to the nucleus, yes, your material is ready, come on, get lost, leke jao yahan sir, kaam karo. Now mitochondria is telling nucleus, okay boss, you told me to produce only 10 grams of amino acids and fatty acids, but see, I have got 100 grams of amino acids, fatty acids, please use it, please debulk me, I am getting overloaded. And mitochondria sends all these free radical and excess amount of upadhatu, free fatty acids, and everything liberates into the cell. Now nucleus has to use this material. So what nucleus will do? Nucleus will suppress the controlling mechanism. See, one cell give rise to one or two cells, normal cells. Okay, this is happening in a very controlled manner, the cell production. But now nucleus will suppress this control mechanism, and nucleus will stimulate oncogenic process, stimuli. So from one cell, it will use multiple number of cells, which are abnormal, in order to finish the stock. Okay, and these abnormal cells, they piled up. Now initially your immune system will be triggered, because your immune system is, trained that if there is an abnormal cell, please kill it. But unfortunately, because of this lactic acid and because of other factors which I will discuss in the due course, your immunity is not able to kill. So these cancer cells or abnormal cells keep on, piling up. Practically 50 lakhs of abnormal cells are produced in our body, and they are killed. We are not aware of it. Thanks to God, we are so having such a good immunity. So out of this 50 lakhs, if one or two or say 10 cells, abnormal cells, they leak and they start colonizing. Okay, so that becomes cancer process, and then they will spread and the cancer sets into the body. Okay, so see how it happens. There is a little repetition, but it will make you easy to understand. So damaged mitochondria, abnormal oxidative phosphorylation, catabolism is reduced, anabolism is increased, excess amount of lactate, free radicals, fatty acid, etc. The heat production is also reduced. Reduced thermogenesis, गर्मी पैदा नहीं हो रही है, because of which also the fat accumulation occurs. Insulin resistance increases, and again your immunity is not able to work effectively. Then your nucleus, it suppresses the apoptosis. The abnormal cells are killed, but that apoptotic methods are also suppressed, and abnormal and proliferative cancer process is set in. All these are from the journals, not from my caricature. Like, so reduced quantitative and uh, So reduced quantitative and qualitative mitochondria cause oncogenic process and progression. You can see the mitochondrial DNA depletion. Okay. So hypoxia, infectious diseases, antibiotic, excess amount of free radicals, because of excess of radiation, stress factor, your mitochondria is damaged. 95%. 5% genetic is also possible. Now this mitochondria is small. Whenever you eat food, mitochondria, they fuse and they become big and they swallow all the food. But this mitochondria are not fusing. They are smaller, smaller, smaller. So this is called mitochondria division protein. So that is not allowing them to fuse. Okay, and they are keep on dividing it. And because of which intracellular genetic expression is also changed, altered nuclear gene expression, and oncogenic process is started. These cells proliferate, they acquired migration. Generally, what we call normal cells are epithelial. Epithelial to it becomes mesenchymal. Cancer cells are mesenchymal. So these mesenchymal characteristics, they migrate, they proliferate, they overgrow. Okay, so this is how oncogenic process is set in. The etiological 95% environmental factors like antibiotic, radiation, alcohol, smoking, obesity, infection, they all damage mitochondria. Now, in one cell, there is only one nucleus, okay, which is also surrounded by a strong vault. It is difficult to approach nucleus. Dada hai bhai wo. But in one cell, there are minimum 300 to 400 mitochondria are there. So easily susceptible organelle is mitochondria. Okay, so mitochondria are damaged. And that's why this 400, 500 mitochondria, they will start producing so much of fatty acids and amino acids and nucleic acid. And one nucleus is not able to control. So your oncogenic process is started. Okay, again, so damaged mitochondria suppresses apoptosis, stimulates growth and proliferative signaling. Okay, reduce thermogenesis. Okay, so these are the journals which are saying it is clear that biology of mitochondria in cancer is central to our understanding of cancer biology. It is from 2016. So mitochondrial support tuberogenesis, oncometabolites are produced. what I said, substrate, this excess amount of upadhatu, all fatty acids, nucleic acid, they are abnormal. So they are like, they work like a oncometabolite metabolite products. Okay. Then there is a biogenesis, fusion dynamics of the mitochondria. Mitochondria are divided smaller, and they keep on producing more. Your cell is producing more and more upadhatu. Okay. Then because of this, there is a capillary angiogenesis. The you can see there are, this is the blood vessel, and this capillary angiogenesis, number of more angiogenesis are formed, blood vessels are formed, and now these cancer cells, they go to the blood vessel and they locate to other place. So abnormal mitochondrial function, okay, reduced mitochondrial function, angiogenesis, and this is metastasis. So triggering factor initially is mitochondria. A wonderful trial was done in which what they did, they took the normal cell, this is the abnormal cell, cancer cell. So they said ki, okay, now if you say that cancer is because of the nucleus, so let me take this healthy nucleus and put into the cancer cell. So they took out this healthy nucleus, put into the cancer cell. If the nucleus is healthy, they should not, it should not cause any kind of cancer, but these cells, they become cancerous only. So they tried another way. They took abnormal or cancerous nucleus, okay, from the cancer cell and put it into the healthy cell. Okay. So they replace it, healthy mitochondria, and they found that because of the healthy mitochondria, these cells did not become cancerous. So this proves that mitochondrial support is very essential. DNA mutation I'm not denying, but without mitochondrial support, cancer cannot initiate, cancer cannot survive. Okay. So the results suggest that tumors do not arise from nuclear genomic defects alone, and that normal mitochondria can suppress tumorigenesis. Now, this is in your hand to treat mitochondria. Okay. These are from journals of seminars in cancer biology 2017 and so. So cross talk from non-cancerous mitochondria. If some cells are healthy with healthy mitochondria, so those healthy mitochondria are also talking to cancerous mitochondria, and they can give signal to become abnormal to normal. This can happen. Okay. So mitochondria organelle transplantation, this trial again they have done in 2021 or 22. So I am sure in coming few years, they may come with something mitochondrial transplantation. Okay. Now, in a cell, not all cells have abnormal mitochondria. So suppose 50% cells are having healthy mitochondria and 50% are having unhealthy mitochondria. Okay, so they will respond better to treatment, chemotherapy. But those who have only 20% of the healthy mitochondria and 80% unhealthy mitochondria, they will not respond. They will respond and they will be again relapse. This is where Ayurveda will work. You need to improve the mitochondrial function so that relapse is not there. You reduce the unhealthy mitochondria. This is proven that those who have healthy mitochondria, they respond better. They do not have chemotherapy resistance. And unhealthy mitochondria, they have chemotherapy resistance. Okay. Now, what is mitochondria? Are mitochondria and Agni same? Since 2000 or 2002, I have been bombarding this principle that Ayurveda ka Agni and mitochondria are same. Both have the same maternal inheritance. Can anyone tell me Agni ka inheritance Ayurveda में क्या लिखा है? आर्तवम आग्नयम. Okay, Agni कहाँ पे है? Agni है आर्तव में. Shukram Saumyam. Now, mitochondria is only and only, which is the powerhouse, which is responsible for metabolism and digestion, is inherited only and only through ovum. Sperms do not have mitochondria. In the sperm's head, there are no mitochondria. It is there in the neck, just used to the push, okay, and to give the nourishment to the head. But the head per se does not have mitochondria. So this is one concept, most important. Artavam Agnayam, we know Artav is Shukram Saumyam. Mitochondria are from the ovum, not from the sperm. Okay, both are responsible for cellular function. All kinds of cellular functions are depending upon the mitochondria. If mitochondria die, that cell die. If mitochondria become sick, that cell becomes sick. Okay, mitochondria gives energy. Mitochondria responsible for healthy aging, your energy, youthfulness. So don't you think so? The shlok of Agni, Ayu, Varna, Bala, Swasthya, Utsaha, Upachaya, Prabha, Ojo, Tejo, Agnaya, Deha, Agni Hetu Kaha, Shante Agno, Mriyate, Yukte, Chira Jivati, Anamaya, Rogi, Syat, Vikrute Tasa. You see. आयु वर्ण बल स्वास्थ्य उत्साह उपचय प्रभा ओजो तेजो अग्नि प्राणश्च उक्ता देह अग्नि हेतु कहा शांते अग्नो अग्नि अगर मर गया so that cell die yukte chira jivati anamaya if agni is healthy robust person will live forever rogi hi syat vikrute moolam agni but what if the abnormal agni does not die in other diseases abnormal agni may become weakened and it may die. So that disease will be cured. In cancer, the abnormal Agni, Manda Agni, is constant, doesn't die. And it will not give rise to strong inflammatory reactions and responses. That's why cancer cells do not have very strong inflammatory signs and symptoms. And they never die. They keep on surviving. We know in modern medicine, cancer cells, it is said that they are immortal. Okay, they don't die. Okay, in Ayurveda, whether do we have this kind of shlok or reference? Let us see. Okay, rogaha sarve api mandegno bhavayet charak samhita. Now see this mitochondrial damage either because of the mutation or because of the environmental. Okay, now see what are the diseases. So because of the damaged mitochondria, patient can get diabetes, obesity, cancer, abnormal inflammation, aging, apoptosis, pulmonary fibrosis, heart failure, kidney failure, diabetes. See, practically all the diseases are because of the mitochondria. This is my concept of Ayurveda, written in Sanskrit for so many thousands of years ago. That's why Ayurveda is Shashwata. You know. So this is the I feel so much moved when I see all these things and when I read all these things. Now we have got Sanchay Prakop, Prasar, Sthan, Sashay, Vyaktivet. So what happens in cancer? This is modern pathology, accumulation of oncometabolite, excess amount of your, all these polysaccharides, your fatty acids, lipid acids, all these things are accumulated. These are oncometabolites. Followed by loss of tumor suppressing functions. That is Prakop, they keep on increasing. Then there is an unlimited proliferation, prasar, there is an angiogenesis, and they will keep on spreading. Then sthana samshraya, invasion and colonization. Okay, it will localize. Vyakti expression. Most of the time patient comes to you in the third or fourth stage. खोकला येतोय अरे खोकल्याचं औषध दिलं काही त्रास नाहीये सर एक्सरे पण नॉर्मल है पहले तो कुछ था नहीं सिटी स्कैन वगैरह कुछ भी नहीं सर बहुत खोखला आ रहा है बाद में वजन कम शुरू हुआ अरे देखते सिटी स्कैन निकालते अरे सिटी स्कैन में देर इज अ लंग कैंसर some 60-year-old female comes to back pain you treat with the PID and sciatica and osteoporosis and arthritis what not एक्सरे नॉर्मल है क्या करने का हाँ ठीक है यार बोन वीक हो गया 60 साल का बूढ़ा हो गया अभी क्या करेगा one sudden she find that there is a fracture and you do MRI and you see that अरे बाप रे there is a cancer metastasis it could be multiple myeloma it could be breast cancer it could be anything so we come to know only after third or fourth so we all Vaidya should be vigilant. Don't treat symptomatically. Try to understand what, why, how, ka, kyun aaya. Why there is a cough. Why there is always in my clinic I examine police. POLICE. P for pylori, O for organomegaly, L for lymphedema, I for icterus, C for cyanosis, E for edema. So if somebody comes to me with the cough and also having icterus, somebody comes to me with the back pain and is also having icterus, somebody coming to me with the back pain and pylori. So why try to correlate? Do your clinical workup to your best. Just don't give अरे खोखलाला कंटकारी देऊन टाकलं कंटकारी से खांसी कम होगी बट डिसीज नहीं ठीक होगा हाँ बैक पेन है मैंने योगराज गूगल दे दिया अरे पेन कम होगा बट यू आर नॉट ट्रीटिंग द डिसीज इट विल मास्क सो ट्रीट ठीक है तो ये आप लोगों को बहुत जरूरी है करना क्लिनिकल इन्वेस्टिगेशंस एंड क्लिनिकल एग्जामिनेशंस डोंट डिपेंड अपॉन द इन्वेस्टिगेशंस जस्ट keep on perfect your clinical examination and I'm sure you will learn this and you will be able to pick up cancer diagnose cancer at the earliest stages so these are the 6 stages of cancer according to modern science and according to Ayurveda. Now see what Ayurveda says. In Ayurveda, there is a word used, arbudadnya. Sushruta has written this word, arbudadnya. It means in those times also we had cancer specialist oncologists. See, arbudadnya. So legally I can become arbudadnya. My grantha में मेरा reference दिया है यहाँ पे. Okay. So what Sushruta says, ahara madhura rasa acheshta स्थौल्य मर्माघात गरविष. गरविष क्या है भाई? गरविष है ना आपका अल्कोहल, स्मोकिंग, योर पेस्टिसाइड्स, योर प्लास्टिक, योर ऑल रासायनिक खत, ये जो कुछ भी आप यूज कर रहे हो ये सब उसका गर्विष ही है. There are so many cases of cancer in Punjab and Tamil Nadu because of all these pesticides. All these whatever things are used for the more yield of the crop, they're all hazardous. Whatever dye we are using, makeup we are using, lipstick and all those things, they're all garavish. Plastic glasses, they are proven to have, the cancerous process. Aging, of course, not in your hand, but keep yourself active fast. Okay. Adi janita doshena sammurchita manda dhatva agni shota. This is what Sushruta says about cancer. Manda dhatva agni janya shota. Okay. And dhatu vruddhi mahantama. कंटिन्यूअसली धातु वृद्धि होती रहती है. महानतम, इट कीप्स ऑन ग्रोइंग इनसाइड, धीरे धीरे होते रहता है. अनल्प मूलम, इट कीप्स ऑन स्प्रेडिंग. सो दिस इज नथिंग लाइक एन एंजियोजेनेसिस. वृत्तम स्थिरम चिर वृद्धि. सी चिर, when somebody touch you touch the feet of your teacher, they say chiranjeev bhava. So chira shabda is used only in cancer. Chira vruddhi. Vruttam sthiram chira vruddhi. So these cancer cells are immortal, written in Ayurveda. They have got a replicative immortality. According to Journal of Cancer Discovery 2022, American Association of Cancer Guideline, Cancer Research Guideline. Okay, I have tried to give you best of the references. Apakam mandarujam. Because your immune system is not able to kill, so there is not going to be an inflammation. There is no cross reaction. Adhi arbudam, dvi arbudam. अधि अर्बुदम मीन्स एक ही जगह पे दूसरा अर्बुद होना, वैसा ही होना. ओके, दैट इज कॉल्ड रिलैप्स. द्वि अर्बुदम, मेटास्टेसिस, स्प्रेडिंग टू सम अदर स्पेस. एक ही जगह पे कैंसर होना, अधि अर्बुद, और एक ही जैसा कैंसर दूसरे जगह पे होना, दैट इज कॉल्ड द्वि अर्बुदम. कालांतर असाध्य. सो सी माय प्रोग्नोसिस इज व्हेन पेशेंट आस्क मी, डॉक्टर क्या क्योर हो जाए? कैसे होगा भाई, आपका पूरा मेटास्टेसिस हो गया है. डोंट गिव एनी टॉल क्लेम, नहीं होगा. योर ग्रंथकार बोल रहे कि अगर द्वि अर्बुद हो गया है, अधि अर्बुद हो गया है, तो इट बिकम्स डिफिकल्ट टू क्योर. सो गिव गार्डेड प्रोग्नोसिस, डोंट गिव टॉल क्लेम. वेरी इंपॉर्टेंट. डोंट बिकम अ बाबा. आप बाबा नहीं, आपका गला कोई नहीं पकड़ेगा, उनका गला कोई नहीं पकड़ेगा, आपका गला पकड़ लेगा कायदा. ठीक है. तो अधि अर्बुदम, द्वि अर्बुदम, कालांतर असाध्य. दे बिकम केमो रेजिस्टेंस. Then we have got different phenotypes, वात पित्त कफ रक्त मांस मेदर. ओके, एंड फिनोटाइपिक प्लास्टिसिटी इसने भी लिखी है. चिकित्सा कर्षण. फर्स्ट ऑफ ऑल, नाउ there are certain in Ayurveda it is written, you put some maggots, like you give that jaggery and urad ka dal ferment and let the maggot come. And I used to feel obnoxious, yaar ye kya treatment. But recently I have read that maggot can help in cancer, where the surgeon's knife cannot go. The maggots can be generated, medical maggots, because they eat only the dirt, the necrosed part. So the maggot treatment which was written in Ayurveda is also scientific, not obnoxious. So karshana chikitsa. Okay, don't apply any लेप. बट फिर भी मैं आपको बोल रहा हूँ, लेप से तकलीफ होती है, फट जाता है. गिव सम पेशेंट बल अच्छा है तो पंचकर्म से कर्षण करो, लंघन चिकित्सा से कर्षण करो, पाचन से कर्षण करो, जो भी दूसरे द्रव्य बताए हुए शोथग्न, वो सब आप दे सकते हैं. कर्षण करके शस्त्र कर्म. Okay, the word is used, the one who is stable hand, he should do shastra karma, followed by agni karma. Agni karma is nothing but the radiation. You are burning for getting 100% necrosis. Okay, and followed by rasayana, so that cancer doesn't recur. See, emerging evidences. So one thing is clear, that agni is mitochondria, mitochondria is agni. So if you treat mitochondria, if you treat agni, outcome will be same. Now it becomes very easy. I can treat Agni. Okay, now I have to prove जो अग्नि की मैं दवा चिकित्सा कर रहा हूं, लेबोरेटरी में माइटोकॉन्ड्रिया के ऊपर असर दिखाती है क्या? लेट अस सी. So emerging evidence targeting mitochondrial metabolic dysfunction and cancer. See, these are the references that if you treat mitochondria, cancer process is arrested. Okay. Now, what are the herbs we use for Agni? एक हम यूज करते हैं फास्टिंग. Okay, दूसरा जिंजर. All कटु तिक्त कषाय रसात्मक द्रव्य we use. Okay, piperine, chitra, garlic, kalamegha. Now, do you know something very funny? We have bitter receptors on our tongue, on our lungs, on our intestines. Everywhere we have bitter receptors. Now, these beta receptors or tikta rasatmak dravya, beta is excellent anti-inflammatory, excellent anti-cancerous. But cancer cells, they do not like bitter. So they make person to avoid bitter taste or bitter food. They like sweet. So patients' craving for sweetness is increased. That could be also one of the signs of cancer. Is suddenly somebody is finding, to increase the sweetness. It is not always diabetes. Okay. So the cancer cells, they survive on glucose. Okay. Abundance of the ATP and molecules and everything. So they like the sweet. And the bitter they avoid. So bitter rasatmak, tikta rasatmak dawaiya are the best for Agni and they are best for the mitochondria. I will show you how. Okay. Then उसके बाद में हम यूज करते हैं शोथ के लिए और इस बाकी आमवात एंड ऑल दोस थिंग्स के लिए कटु. ओके. अग्नि दीपन एंड अग्नि पाचन, जो आम का पाचन है, वो यूज कटु रसात्मक तीखी दवाइयां जैसे जिंजर, black pepper. So let us see whether black pepper, ginger, which we know that they improve Agni, let us see how they act on mitochondria. See, this is the Langhan. Okay, fasting is, improves Agni. We know. Now, fasting improves mitochondrial function. The Nobel Prize was given to this Japanese scientist in Oshomi in 2015. He said that he's proven that autophagy, by doing fasting, the mitochondria starts eating the internal debris, and because of which a lot of inflammation and cancer process is arrested. So useful in type 2 diabetes, infectious disease, immunological disorder. This is in 2015. I will show you something very important. He is my guru, Dr. Devchan Gala. He is MBBS. Okay, and he is doing Ayurveda practice, pure Ayurveda practice for almost 45 years, 47 years. He taught me Langhan. Dr. Gorodia sir taught me Langhan. ओके. सो ये जो लंघन चिकित्सा है, लंघन चिकित्सा जो सर करते हैं, गोडिया सर ने जो हमें सिखाई है, देवचंद गाला सर जो हमें सिखा रहे हैं, ये लंघन चिकित्सा इज द फर्स्ट ट्रीटमेंट. Okay, ideally these people should have got the Nobel Prize, not the one who got in 2015. We are doing for so many ages. Okay, so see this. I will show you further. Outcome of fasting. Now these are the genetic effects of fasting. When the fasting is given in the form of calorie restriction diet, intermittent fasting, alternate day fasting, short fasting, and long-term fasting. So they modulate the aging process. They prevent the expression of genes associated with programmed cell death and apoptosis. They down-regulate the expression of genes discussed with DNA damage and induces genes. So DNA repair, which is not happening in cancer, the DNA repair process is halted. Okay, because P53 is suppressed. Now, if you do fasting, your P53 improves, your genetic repair improves, and you are actually preventing patient from getting relapse. See, these are the outcome of fasting. 36% reduction in the metastasis due to down regulation and reduction of insulin-like growth factor. Interleukin 6, most inflammatory cytokine. Tumor necrosis factor and CRP, inflammatory cytokine. So they are reduced, once just by doing fasting. They upregulate the apoptotic pathway. They keep on killing the cancer cells because body wants to use that debris. So they upregulate aldolase, A, DNA, PK, P53 pathway. Okay. Tumor growth factors are suppressed. They increase mitochondria. Number of mitochondria are increased. They allow mitochondria to fuse. The mitochondrial division protein is suppressed. Increase autophagy, increase apoptosis. Errors in DNA replications are reduced. Tell me single drug which can give you so many outcomes. Not a single drug. And fasting, no paisa. That's why people are not doing clinical trial. Okay, so do fasting. Okay. Now, I know that Dr. Datta will not agree unless I give him a biopsy evidence. So this is the biopsy evidence that if you subject a person to a fasting, insulin sensitivity increased so much and insulin resistance is reduced. There can be no better evidence than this kind of biopsy evidence. So markers of mitochondrial biogenesis are increased when person is doing fasting. Okay, and insulin sensitivity is increased, and insulin resistance is reduced. So IGF-1 is reduced, your inflammation reduces, your cancer process reduces. Okay, so simple fasting is important tool. दत्त बोर होत नाहीये ना?
No, sir.
नाही
Okay.
सर.
जास्त डिफिकल्ट तर नाहीये ना?
No, sir. It is very interesting, sir.
Thank you. Mitochondria are the new class of drug in cancer. Synthesis of mitochondria exert lots of adverse effects. Double bol diya maine to. So now there are new class of drugs called mitochondria, the drugs acting on mitochondria. Okay, they are very useful in cancer. But lafda ye hai, they have a lot of side effects. The synthetic mitochondria. So here comes the role of Ayurveda. See, mitochondria, a category of drug known to precisely target the cancer cells. Okay. So now andrographis, that is Kalamegha or Chiraita, ginger, mitochondria 2, berberine, daru haldi, ashwagandha, mitochondria 3. These are the classification. Curcumin, turmeric, mitochondria 1, 2, and Cissus quadriangularis. Okay, so these are various classes of natural mitochondria. Use it. It is proven. We all know andrographis, that is Chiraita and Kalmeg, Tikta Rasatma, improves Agni, Dipan Pachan. Ginger, again Dipan. Berberine, best Pachan. Ashwagandha, Rasayan, Ushna hai, पर Rasayan hai. Okay, angiogenesis अश्वगंधा से कम होता है. Curcumin, it improves NF kappa B. It helps to improve, suppresses NF kappa B and improves P53. Okay, Cissus quadriangularis, it prevents bone loss. Zoledronic acid we use to prevent the bony metastasis. Use Cissus quadriangularis. Okay. Now, mitochondrial marker. So there is a mitochondrial marker called 8-hydroxy-2-deoxyguanidase. Now, if I give ginger, so this mitochondrial marker excretion in urine is reduced. Whenever there is a mitochondrial division is more because of the division protein 1, there is a degradation of mitochondria. So this mitochondria के membrane में जो enzyme है mitochondrial 8-hydroxy-2-deoxyguanidase, it will be excreted in urine. So if you give ginger, this excretion is reduced. It means it prevents mitochondrial damage. This is another evidence. We are always asked की बाप दाखव नाही तर श्राद्ध कर, तर हा सूर्य आणि हा जयद्रथ, हे त्याला उत्तर. So give mitochondria, give ginger, mitochondrial degradation is reduced. We have proven that mitochondria plays important role in cancer. So ginger plays important role in cancer. पित्त प्रकृति है तो मत यूज करो, दूसरी दवा यूज करो. Use it with the yukti now. There you will play. Modern people do not know about pitta and anything. You know, so you will have an important role. Sir, ginger यहाँ मत दो, ये पित्त प्रकृति है. Black pepper यहाँ मत दो, ये पित्त रक्त प्रकृति का व्यक्ति है. We will give different drug. Take this help, take this advantage. Okay, okay. So if this is reduced, it also predicts cancer risk. If higher, 8-hydroxy-2-deoxyguanidase, cancer chances are higher. If reduced, cancer chances are less. Effect of ginger in inflammatory. So ginger is also very excellent in anti-inflammatory medicine. It reduces CRP, it reduces TNF alpha, and it reduces interleukin 6. Now this tumor necrosis factor and interleukin 6, these cytokines are secreted by macrophages. They are very strong, very inflammatory. They keep on damaging. They keep on damaging our, they generate the autoimmune reactions. So whenever there is an inflammation, these markers are increased. And they help, this inflammatory, the low grade inflammatory, environment help cancer cell to survive. In cancer, you will not get IL-6 very high like a bacterial infection. Okay, but whatever is there, that keep on increasing slowly piling up. And that's why, that is bad. So the ginger reduces tumor necrosis factor, interleukin 6. C-reactive protein is a marker also and is an indicator also. So that also reduces. Okay, IL-6 reduce हुआ तो CRP reduce होगा ही होगा. Okay, so but we come to know IL-6 examination is costly, CRP examination is cheaper. So you can ask if the CRP is reducing, it means okay, the cancer process is reducing. Next what? So ginger and the purified component as cancer chemo preventive agent. My honest opinion, don't use single ginger oil, curcumin. There I had to use it in Tata Hospital because I had no choice. But this active molecule is dangerous. Use your whole extract. यूज एज पर रिटर्न इन आयुर्वेदा. आप काढ़ा यूज करो, जो भी यूज करना है आपको, तो आप वो यूज कर सकते हो, लेकिन जिंजर ऑयल, कर्क्यूमिन अकेला दवा देके मत करो. दैट विल हैव मोर साइड इफेक्ट्स. Okay, so ginger extract inhibit human telomerase reverse transcriptase and see my lung cancer. So read about this. I will not go into the detail. Next is piperine. Now cancer cell, it keeps on growing through certain cyclin dependent kinases. These cyclin dependent kinases, they are in abundance, they are more in cancer cells. So piperine, blocks these cyclin dependent kinases, because of which cell cycle is arrested, cell process progress is arrested. Third drug is Chitraka. Okay, and it acts on HER2 positive cancer cells. This is in Onco-Target journal. It's a very established journal in cancer field. So Chitraka is excellent. People, अरे भाई ये तो हमारे सब दीपन द्रव्य है. They are useful. So all दीपन द्रव्य, पाचन द्रव्य, दारू हल्दी and all, they are useful for cancer. Okay. Now whenever you have time, you just go through all this, because time is running short. I have to the novel curcumin again, mitochondria. Now they are developing the drugs which will directly act on the mitochondria, the curcumin. Okay, so at that time, we may use curcumin. Modern people will use curcumin. Okay, ashwagandha useful. Okay, angiogenesis kam hota hai, improves mitochondrial dynamics. Okay, go through all these papers. Ashwagandha acts on the cancer stem cells. Chemotherapy can kill cancer cells, but cannot kill cancer stem cells. Okay, but ashwagandha kill cancer stem cells. That's why ashwagandha helps in preventing relapses. Ashwagandha, lot of trials are done along with gemcitabine and all other chemotherapeutic agents. Not all, but few. But they found that sorafenib and gemcitabine, if you give ashwagandha with them, they act synergistically. There are no adverse reaction. Okay. So again, this is for the ashwagandha. These are the ashwagandha, anila, shleshma, shotha, shvitrakshayapaha, rasayani, and nisha, tikta, katu, ruksha, haldi, apachi, kind of cancer, pre-cancerous condition, mehatva, gavisha, shotha, jita. Okay, this is curcumin. Vascular endothelial growth factor reduces NF-kappa B, TNF alpha, STAT, mTOR pathway is suppressed. Most important, mTOR pathway is suppressed. It improves cytochrome P450, P53. So NRF pathway, adenosine monophosphate kinase pathway. So all these things are pro-apoptosis. All these BAX, BAD, BCL, these are apoptotic molecules. They are increased because of the curcumin. Okay, and anti-apoptotic like BCL2, BCL1, they are all reduced. Then I think. So bhang is also very excellent. Use good quality bhang product. I am not promoting any product per se, but I am using CBD oil of Solazan. The name is Solazan of Pilkrat Pharma. This I found very good. You can try other whatever you feel good, but I am using this. Okay, Solazan, which does not contain any kind of THC, plain CBD, so you can use it legally also. I have got more than 2,500 patient का data. Keep data is most important. सबका documentation करो. आया result नहीं आया, जो कुछ भी Excel sheet बनाओ और उसमें डालो. So this Solazan is very good. It suppresses mTOR pathway, pain कम होता है, sleep अच्छी आती है. But again, fourth stage में there are no cure. You have to use it as soon as patient finishes chemotherapy or during chemotherapy. Start that. Okay, and learn about cannabis and then use it. So see CBD, regulatory effect of cannabidiol, cannabidiol. Okay, it acts on mitochondria. So CBD is an excellent medicine to improve mitochondrial function. Okay. So bhanga, kafahara, tikta, grahini, pachani, lagu, tikshna, ushna, pittala. So because of the cough, or you can consider all those lactic acid and in the lactate dehydrogenase as a amount of cough and and bhang helps to reduce it. Okay, but use it cautiously. He is Dr. Syed Tahir Hassan, who taught me about. He's from Kerala, and he taught me about the cannabis. I had done a certificate course under him. Okay, cannabinoids as an anti-cancer drug. So we have done a trial in Tata Hospital also, and we found that giving cannabis pre-operatively, the purpose was only, end object was to see whether we have to change the anesthetic agent or reduce the or increase the drug of the anesthesia. But fortunately, there was nothing, no side effects. And what Dr. Badwe, sir, Dean of Tata Hospital, he said that he found if intraoperative biopsy of cancer patient was done, because of the effect of anesthesia, the activity was reduced. So that was his hypothesis, that if you give us some drug which can carry forward the anesthetic effect, so cancer cells will become dull and they will not recur, they will not relapse, okay, and they will respond fast. So with that concept, the CBD trial is done, because CBD acts like an anesthesia on the cancer cells. Another drug is morphine, afim, but that has got a lot of legal problems, and afim is not that good. It is psychoactive, more of psychoactive dependency. But bhang, you can use it. CBD, you can use it. Okay, solazan is without any THC, so that you can use it, and use it regularly in a small dose. So these are the effects of cannabinoids. Okay, how it acts: inhibits tumor invasion, metastasis, angiogenesis. We have got receptors on the body. Now, those who are yogi, those who are relaxed, okay, those who are doing meditation, they have got more CB1 and CB2 receptors, so they will respond fast. Okay, but those who have less amount, what I have found that those who are बहुत चिड़चिड़े रहते हैं, उनको शायद इफेक्ट कम होता है, लेकिन जो शांत संयमी है, कफ प्रकृति के है, उनको इफेक्ट जल्दी मिलता है. Okay, so these are all things which you can go through. How bhang acts intracellularly, it generates certain kinds of toxin in the cancer cells, and because of which cancer cells die. It prevents all three stages: proliferation, apoptosis, and autophagy, because of which the initiation, growth, and progress is affected. Okay. Now, our many drugs, the macrophage is very essential. The active macrophage is M1. Okay, so M1 secret general of lot of armamentarium which will kill cancer cells. But infectious agents and cancer cells, they want to make macrophage inactive. They want macrophage to macrophage 2, okay, which is unhealthy, which is I mean to say which will not help to kill cancer cells. But bhang, tinospora, they make macrophages to macrophage 1, and because of which cancer cells die fast. Okay. So again, these are all things you can go through. So these are the papers 2267. This is from 2021. After that, बहुत और study हुआ रहेगा. Okay, so you can go through all these things. I will not go into the detail. Okay. So this trial was done and published in Journal of Cancer Radiology, that if the tea, green tea, chiraita and clove was given, and the animals were subjected with carcinogen. So, and second group which was not given this tea, so they develop cancer fast. And these people, the tobacco induced cancer, okay, it was reduced, those who were given this tea. It doesn't mean that we should ask patient to tambaku bhi chalu rakho aur ye lo. No, they should stop tambaku and smoking. But if you give this tea, that will definitely help them to prevent the cancer occurrence. Friend, there are 35,000 plants are there, and 3,000 plants have reproducible anti-cancer activity. This I am not saying. This is from National Cancer Institute. Okay, so we got a lot of scope, for Ayurveda doctors. We can do all things together in a better way. Now, herbs improving mitochondrial function, as I already discussed. In Ayurveda, what is written? Madhura ras is bad. See, Madhura ras causes arbuda, sweet. Effect of eating sweet in excess, and cancer cell want you to eat sweet. Wherein bitter rus, it reduces tikta swayam arochi. Cancer cells will not want you to eat this thing, but it is reduces with visham, visha, kushtha, murja, daha, pitta, kapha, shotha. All these things are reduced because of the bitter rus. So give that. These are the extract. These are my old slides. So this was a trial which we have done in Tata Hospital, Dr. Manish Agarwal, Dr. Lal Hingurani. So though doctors from TMH are actively involved into the research on herbs and cancer, they do not advise to stop chemotherapy, etc., and take only alternative medicine. So this is a disclaimer one has to understand properly. Don't misunderstand, misinterpret. So what we actually proven that curcumin and ashwagandha, they are very useful. Our main work was to establish the dose, and the dose was very high. If that dose is achieved, cancer is curable, but we could not reach to that dose. Okay, so this was, Longvida is a formulation and Ashwamax is a formulation. So they were solid lipid curcumin formulation, and absolutely they were safe. There was nothing. We tried the level of curcumin from other turmeric in the market, but they did not reach to that level. So these are all papers which are available. You can all go through it. The pharmacokinetic studies no one has done on curcumin. We were the first to do that study on curcumin and ashwagandha, and we have proven that our formulation called curcumin, longvida and ashwamax, they reach to the blood level. Okay, so these all things you can Google it and find it. Ashwagandha has got excellent result on glioblastoma. This was proven on the rat model. A very good result on cervical cancer, curcumin. Okay, so these are all papers. These are all our papers published in various journals. These are all trials. If you are interested, you can go through it. What were the aim, objective, inclusion, exclusion criteria? This is on the cannabis. What trial we have done and what dose to be given or not given, everything. This is a case, it was acute lymphoblastic leukemia was treated by cannabis extract. Wonderful case, Canadian case. You can go through this case. And these are my personal, this is very old slide. As I said, now more than I think 700, 800 patients of cancer and 2,500 patients. I have treated restless leg syndrome, 2 patients, motor neuron disease. Did not get that much result, but she was better. Huntington chorea got fantastic result, multiple sclerosis, severe arthralgia, chemo-induced neuropathy, very good result. Side effects were transient delirium, little constipation, little sweating, nausea, vomiting, but no organotoxic because of the solazan. No one got, any kind of adverse effect. So these are again, nothing to promote this, but they are good one. Solazan, Odin Care. Odin Care is used by orthopedic surgeons also. It contains shallaki and cannabis. One day, I asked my orthopedic friend that, one of the family person is having so much of the shoulder pain. What should I do? So he said, there is a new drug in the market called Odin Care. You try. So this contains shallaki and bhang. I was also not aware when he told me. Thereafter, I started using it. This Odin Care, Trilokya Vijayavati, Solazan. These are all good products. So in the beginning, that slide was not there. 4 cases of mine. They all relapsed in 1 year. Now these are my cases. There are so many cases from 2008, 2014. They are still in touch with me. Few of them died because of the heart attack and during COVID, but most of them are surviving. Again, this is not double-blind placebo control trial. So I cannot say that it is only because of Ayurveda drug, but they took chemotherapy, radiation surgery, and they started my medicines immediately, and the survival rate is more. So this kind of documentation I have done, and I am ready to share all these things and all these cases with anyone. Okay. There are 2 cases of multiple myeloma, bone marrow transplant failed, and they are on Ayurveda medicine and they are doing good. So these are all multiple cases. I don't know whether it will run or not.
Sir, it is not audible.
Okay. So this is another case. Her brother had sarcoma, metastatic. He is also better. This is a wonderful case. He died, of course, glioblastoma. He was totally bedridden and he started eating and everything, started walking. But ultimately he died. Honestly, he died. His glioblastoma also reduced a little bit, but not much. Okay. See, he was like this. And later on, it became like this. Hey, this time, na? Datta?
Yes, sir. Yes, sir. It is moving. We can
It
see.
was so much. So I was very happy, मला वाटलं की उनका glioblastoma कम हो गया रहेगा, but unfortunately, yeah. So this is the MRI. The tumor size was 9.5 centimeter, July 23, and October, 6-7 महीने की बात है. It reduced little bit, not much. Okay. Now coming to the bhasma, Dr. Bendale, Yogesh Bendale is using bhasma. I don't use that much. I use some metal complexes. I use dissolved in the lipid oil. Dr. Shantaram Kane from PhD IIT is 83, 84. So he has developed patented some technology in which, Hirak Bhasma, copper Bhasma can be diluted into the oil and can be used. I am using right now and I am finding good results of that without having any side effects. So all these, people say don't use metal. The cisplatinum is a metal. Okay, arsenic is a metal which even used by the modern people. So why not to use gold complex, copper complex? We can use it confidently. So this is a trial which was done in university. Tryptophan stabilized gold nanoparticle. That is best. It works on the microtubulin of the cancer, and cancer cells anatomy itself collapses. They die. Their structure itself die. Okay. Now diet. Western diet is bad. Follow Indian diet. जो हमारा संसर्जन. I avoid giving milk and milk products. We will keep separate lecture that why I avoid strongly milk and milk products. Okay, but avoid milk and milk products. Replace them with soy, almond milk, soy milk, oat milk, soy paneer. Okay, almond curd. That will definitely help your patients. Okay, so these are all things. रिस्वेस्टॉल कॉपर कॉम्बिनेशन हे सगळं ठीक आहे. सो फ्रेंड्स, कांजी आपण प्यायला देऊ शकतो. ही माझ्या घरी बनलेली कांजी आहे. सो कांजी आपण प्यायला, कांजी इज एक्सलंट फॉर कॅन्सर. बीटरूट कांजी. ओके, मस्टर्ड सीड आर अँटी कॅन्सरस. Okay, see this, all these things I teach patient. Okay, so pan is bad, but pan actually असाच जर खाल्ला 2 किंवा 3 पान, it actually increases free radical to certain level. Free radical up to certain level, they are anti-cancerous. But if it increases beyond that, then they cause cancer. But cancer cells, they don't want free radicals. Free radicals act as a death messenger. So up to say 10 grams of free radicals, they are good. They will kill cancer cells. And pan increases the free radicals only up to that level. So eating only a pan, not chuna, katha, supari, kushini, sirf pan, that is excellent. See, this is the trial. Bitter leaf, it is excellent for cancer. Not the supari nahi, bitter leaf. Okay. Piper bitter leaf and reservoir of potential anti-cancer properties आहे त्याच्यात. So summary, mitochondrial dysfunction is the most essential pathology for initiation, growth and metastasis of the cancer. DNA mutation is the consequence and thereafter continue the cancerous process. Mitochondria depicts as the structural and functional organelle of Agni. Treatment of vitiated Agni by fasting, bitter and pungent herb will definitely improve mitochondrial function. And treatment based on principles of Ayurveda are too scientifically proven to have chemopreventive therapeutic potential in the management of cancer. Okay, so this is how, I feel we should help our society so that these deaths are by Ayurgenomics. You can apply chemotherapy, targeted therapy, surgery, radiation, along with that Langan, Dipan, Pachan based on Ayurgenomics. So for that, Dr. Mitali Mukherjee ra tumi bolwa, she will really teach you. So that will help us to understand the Vata, Pitta and Kapha in a better way and effectively plan the cancer treatment. So friends, last, it is easy to kill cancer, but the challenge is keeping patients alive at the same time. Okay, so we all can do this and see. So how many dropped from the, how many were there in the beginning and how many dropped? I know it is quite lengthy session, 1 hour, 24 minutes. So if you have any questions, if you still awake, you can ask. Thank you.
Thank you, sir. So it is a request to please stop sharing the slides.
Done. Arima, so many are still there.
Thank you, sir. It is a request to all, please put your all questions in the chat box. Now we will have the sponsor speech for 2 minutes, and then we will go to the question answer session. It is to over to you, Dhaval sir.
Hello, Namaskar everybody. First of all, happy Dhanvantari Jayanti to everybody, and let's pray to God, Lord Dhanvantari, for everybody's good health. Then, secondly, I sincerely thank Dr. Kochar for enlightening us over the last 1 hour about so much. I myself am not a medical practitioner, but I myself learned so much because he explained everything so simply. I thank Dr. Datta, the Gurukul Academy, and Parasnath Clinics for giving us this opportunity to learn so much about cancer. Guys, I feel modern science is often looked at as more scientific than Ayurveda because, according to many people and many people in the society, their scientific method is better than the thousands of years of Ayurvedic practical science. But to solve this, we have started conducting clinical trials of Ayurvedic medicines with the same scientific process that all of these modern institutions value so much, and at the top medical institutions of India. With that, we have launched this brand called the Pain Company, in which we specialize in making pain relief products, Ayurvedic pain management products. Dr. Datta, can you just move to the next slide, please? Yes. So friends, one of our hallmark products is this 206B pain relief oil. This is an oil that we have made, which we have clinically proven to be very effective at KEM Hospital, Mumbai. This clinical trial was a double-blind, placebo-controlled, randomized clinical trial conducted under the guidance of HOD of KEM, Orthopedics, Dr. Mohan Desai, in which this Ayurvedic medicine, friends, was clinically proven to be extremely effective at pain management. Dr. Datta, can you go to the next slide? Yes, here you can see the results of the clinical trial, in which we used Womack scale and VAS scales, two scales that modern science uses to understand pain relief and to measure pain relief. And you can see how 206B, the pain relief oil that we have made, has been so better than placebo. And people often say that placebo pain relief में placebo by बहुत बड़ा effect होता है. But 206B has given 4 times greater improvement in Womack score, and VAS score, which is the visual analog scale score, which is used to measure pain relief, has also shown tremendous pain relief. And all of this, friends, has been done under the guidance of HOD of orthopedics. Modern science is saying Ayurveda is great. This, Dr. Datta, can you go to the next slide, please? Yes. This is a very simple formulation. Only standardized Vijaya extract, which helps in reducing pain and inflammation. Boswellia oil or Shallaki ka tel and MCT oil. That's it. Only 3 ingredients. Very good for joint pain, muscular pain, sports injuries, soreness, osteoarthritis, etc., etc. And I think Dr. Kochar himself has been using this oil since the last 1.5 years. And he has in fact been instrumental for us in developing this product itself. So again, I thank Dr. Kochar for that. And lastly, just one last thing, that Ayurveda is actually very, very strong for pain management, because we don't believe in distracting the body from pain. We believe in actually curing the inflammation, in actually reducing the pain, in actually helping the body solve the pain. So for that, we have built this brand called the Pain Company. If any of the doctors want to get in touch with us, they can do so by, I will just share our business head Paresh Bhatia's number on the chat. So anybody who wants to get in touch can get in touch with Mr. Paresh Bhatia. Thank you, Dr. Datta.
Thank you. Now we are moving to the question answer session. So first question is, in Karshan Chikitsa, as you said, can we do leech therapy or Siraved?
नाही, लीच थेरपी आणि सिरावेद मी करत नाही, पहिली गोष्ट. आणि ती शक्यतो टाळावी असं मला वाटतं, बिकॉज देर आर चान्सेस, देर इज अन एंजिओजेनेसिस. सो देर आर द चान्सेस दॅट विच विल इन्क्रीज अँड विल स्प्रेड. So to best of my knowledge and my understanding, avoid leech therapy. सिरावेध जर करायचं असेल नुसतं तर ते तुम्ही तुमच्या युक्तीप्रमाणे वेदना कमी करण्यासाठी वगैरे तुम्ही ते करू शकता. लीच थेरपी अवॉइड करा.
The next question is, can you define the role of Tamra Basma and Hirak Basma in CA patients?
तर ताम्रभस्म हे उत्तम कर्षणात्मक औषध म्हणून आहे.
Sir, please use Hindi or English.
अच्छा, सॉरी. ताम्रभस्म ये एक बहुत अच्छा कर्षणात्मक भस्म है, अच्छा अगर बनाया है तो. And हीरक भस्म is very good, रसायन plus कर्षण both. So when you want to use for a growth, cystic growth, large growth, use ताम्र भस्म. When you want to use it for mainly preventing, you can use, again, if you want to use it for the long term and preventing, use this diamond basma, but in a small quantity, proper measure करो. और ये जब दवाई आप यूज करते हैं तब strictly you have to measure the liver function test, CBC and renal function test. Always look for the gums, always look for the stool, always look for the some unusual symptoms like any pain in abdomen or anything, oligouria. So keep a watch on these things, but you can use it safely, no issue.
Okay, sir. Thank you. So next question is, in certain patient they deny for the allopathic treatment or surgery, specifically in stage 1 and 2. So can we have Ayurvedic treatment protocol for CA, or it can be always integrated?
So it's a very good question, and many people come to us. See what Sushruta says. No one is above Sushruta, right? So Sushruta himself has said, first do a Karshan Chikitsa. It's like a debulking. So chemotherapy is doing debulking. Okay, one thing. Then Sushruta says you go surgery. Sushruta never said don't do surgery. So if somebody comes to us, and then third is Agni Karma. So this is a protocol of Ayurveda. Now debulking chemotherapy works. If patient is contraindicated for chemotherapy or immunotherapy, then of course we say that you don't go for chemotherapy. Some patient who is 75, 80-year-old and not having bulb, don't give chemotherapy, but give the guarded prognosis that you will not be cured. Ask them to take palliative chemotherapy. Okay, so that will help. Our medicines will definitely help, but there is no still proven data that with only and only Ayurveda, at least I don't have. There are few cases are there, they are not doing chemotherapy, radiation surgery. So having 10, 15 or 20 cases is not a big data. You should have thousands of cases to prove that, without chemo and without surgery, you can do it. Okay, so honestly speaking, patient is fit for the chemotherapy or palliative chemotherapy, give that. Legally also, you are safeguarding yourself. Surgery, if patient is tumor is removable, resectionable, then definitely it has to be removed. Okay, and along with these drugs, you start your Ayurveda medicines and dietary changes. So integrated medicine will definitely help to
Thank you.
cure
Thank you, sir.
cancer.
Thank you, sir. So next question is, when to give Rasayan Chikitsa in cancer patients?
तो पेशेंट रसायन चिकित्सा यानी आप क्या पूछना चाहते हैं? रसायन यानी इफ यू वांट टू आस्क च्यवनप्राश, ब्राह्मण रसायन, सो आई डोंट गिव because these are very highly loaded with the sugars. So don't give. You can give Rasayan Chikitsa, Ashwagandha, Giloy, Shatavari, all these things based on the patient's Agni. If patient is having lots of nausea, acidity, acid peptic kind of things, then don't use all these things. So simple Pachan Chikitsa will definitely help. Panchatikta Kwath is excellent medicine, bitter. It's a bitter Rasayan. In cancer, the Rasayan is different, not the normal Rasayan used to be used. Panchatikta Rasayan. Why? Because this Panchatikta is good for your body, good for you and not good for the cancer. So उसमें जो कट्टकारी, गिलोय, वासा, चिरायता, ये सब 5 दवाइयां है, नीम है, that is excellent. So you can use different form of Panchatikta. You can use simple Panchatikta oil if you find patient is Karshanatmak. Okay. Or Panchatikta Ghanavati. Sometime you can use Panchatikta Gurukul also. बस उसके अंदर भल्ला तक है, ध्यान में रखिएगा. I use Bhallataka also. I use Bhallataka Rasayan, okay, which is made by a good pharmacy, and Shodhita Bhallataka. You can use that as a Rasayan also, but of course keep a close watch on that. Okay.
Thank you, sir. So the last question is, can you define the role of Panchakarma in cancer? Means when to use and when to advise for Panchakarma in cancer patients?
So Datta, honestly, I'm not doing Panchakarma, so I cannot, comment on that. You have to call other person who is expert in Panchakarma. बट बस्ती चिकित्सा आप कर सकते हो, मुझे ऐसा लगता है पंचतिक्त क्वाथ का है या जो भी दूसरी आपको बस्ती योग्य लगती है, आप वो कर सकते हो। मैं क्यों नहीं करता हूँ, क्योंकि एक तो पेशेंट सब काफी आउट ऑफ स्टेशन के हैं, आउट ऑफ इंडिया के हैं, ट्रैवलिंग इंफ्रास्ट्रक्चर इज डिफिकल्ट, आई डोंट हैव दैट स्टाफ, आई ट्राइड माय लेवल बेस्ट बट देन आई कुड नॉट डू इट। एंड वमन विरेचन, पेशेंट का ऑलरेडी केमोथेरेपी चालू है, रेडिएशन है, बल बहुत कम है, तो ऐसे कंडीशन में मैं पंचकर्मा करना मुझे ही उचित नहीं लगा। सो आई एम नॉट एक्सपर्ट टू कमेंट ऑन दैट। There is a question, dry ginger is to be given
Yes.
in diet or weight. So see, dry ginger जो है ये तीक्ष्ण है, उष्ण है, तो कफ प्रकृति अगर पेशेंट की है तो आप जिंजर की चाय बना के दे सकते हो, ड्राई जिंजर की। लेकिन हो सके वहां तक वेट जिंजर अगर आप खाने में यूज उनके सलाद में डाल देते हो, स्टीम किया हुआ सलाद, नॉट द कच्चा सलाद, सॉटे सलाद, या अदरक की चटनी बना के देते हो, तो ये आई थिंक दैट विल बी बेटर। बट अगेन लुक फॉर द, इफ देर आर एनी गैस्ट्रिक इरोजन्स आर देयर, स्टूल में ब्लड जा रहा है क्या, पित्त प्रकृति नहीं है, नहीं, ये सोच समझ के आप जिंजर का प्रयोग कर सकते हैं, लेकिन जिंजर के बहुत अच्छे रिजल्ट है।
Thank you, sir, for your enlightening words regarding how
Along with targeted
integrated.
medicine, for can we use Ayurveda? Yeah, you can use Ayurveda medicine. Keep the gap. My simple mantra is, when patient is admitted in the hospital, don't give your medicine. When patient is at home, wait for 1 day. Okay, next day onward, you give your medicines along with oral chemo, oral targeted, whatever. Keep a gap of half an hour, 30 minutes, 1 hour. First allopathic drug, then your drug to be given after half an hour or 1 hour. And see, start with the small dose. Always start slow. That's it.
Thank you, sir. Can you, sir, sum up with 2 lines that the integral approach of Ayurveda doctors regarding the cancer?
So as I said in my last slide, it is easy to kill cancer, but to challenge is to keep patient alive. So Ayurveda doctors will definitely help to improve quality of life. पेशेंट को भूख लगती ही नहीं, आप कितना भी कुछ भी दो, एंड दैट अरुचि एंड दैट लॉस ऑफ एपेटाइट इज डिफिकल्ट टू ट्रीट। वो हिंगवाष्टक लवण भास्कर से नहीं होता, यू हैव टू रियली यूज योर ऑल नॉलेज टू improve that hunger, the sleep pattern, the pain pattern, all these things, you can definitely improve, reduce the side effect of chemotherapy so that patient can tolerate chemotherapy well, so for that your ayurgenomics will help. Okay, so if you use all these things properly, there is a definitely, I would say, Ayurveda will play onco preventive treatment in cancer a fourth pillar, and you all can become Arbudadnya for this. This is what I would like to sum up.
Thank you, sir. Before going to the concluding part, we were getting a lot of queries regarding the courses in the Gurukul Global Academy. So I just clarify here that sum up with some courses that we are just soon launching some courses. That the first one is the certificate course in integrated oncology. Second is essential pharmacology. Third is Agniman Vida, is a basic fundamental course of in Ayurveda. Essential rheumatology, essential Nidan and Vikruti Vidyan, essential Rasashastra and Vaishajya Kalpana, essential Panchakarma, essential Dravyagun Vidyan, therapist Panchakarma training course, and the last is a offline workshop on basic life support. So the certificate course in integrated oncology, the respected sir, Dr. Nithin Kochaar sir, we have the great core team as a speakers, which includes Dr. Viraj Narvekar sir, Dr. Namrata Bhagat madam, Dr. Ram Nag sir, Dr. Samar Gupte sir, or these are the core team and the leading by the Dr. Nithin Kochaar sir. Next course is essential pharmacology, which will be conducted by Dr. Nimish Narkar sir, MBBS MD pharmacology, currently working in a Somaya hospital as assistant professor. Next is essential Dravya Gun, which will be taken by Dr. Prajakta Patel madam and Dr. Swagata Tavre madam. Next is essential Rasashastra and Vaishajya Kalpana course, Dr. Madhav Bhide sir and Dr. Kedki Bhide madam. Essential of Nidan, which will be taken by the Dr. Anish Pandit sir. The essential Panchakarma course that will be taken by the Dr. Monika Mure madam, Dr. Ravi Bhushan Sonavne sir, Dr. Deepali Sawan madam. The therapist Panchakarma training course, this will be offline and online both. Then rheumatology, essential rheumatology course, and the Offline would be the workshop on the basic life support. I just wanted to know that our next clinical meeting would be on 6th of November. That is the same time, 3 to 4 p.m. The topic is the Pitta Vrutta Vat Ayurvedic Nidan approach in elevated cancer antigen 125, a case report. Our guest speaker is Dr. Durga Datta Vyas sir, practicing in Mumbai, and our guest of honor would be the Dr. Nithin Kochaar sir. For vote of thanks, I give to Dr. Mayuresh sir. Over to you, sir.
Okay. Am I audible, sir?
Yes.
Good evening, everyone. I'm Dr. Mayuresh Sawant, and as a core team member of the Gurukul Global Academy, I'm truly honored to deliver the vote of thanks. On behalf of the Gurukul Global Academy and Parasnath Foundation, I sincerely thank everyone who has made today's clinical meeting special and memorable. First, I would like to start with our very own guest speaker, Dr. Nithin Kochaar, sir, who's been working as a senior Ayurveda consultant for cancer and chronic diseases, for sharing your valuable expertise on evidence-based management of cancer and chronic diseases by Ayurveda. With your 30 years of experience in your practice, with your insights that have profoundly enriched our understanding of Ayurveda therapeutic potential in oncology. And specifically, I would like to highlight, as you told, the mitochondria and the process of onset of oncology. That was really one of the starlight for today's session, I would say. We are really grateful for your session, sir. Thank you so much. Special thanks to Dr. Neha. Yeah. Special thanks to Dr. Neha Mhatre for wonderful introductory session that set the tone for the today's informative discussion that we had. We also have this opportunity with us to, know and synchronize our Ayurveda medicine with this modern contemporary medicine as a holistic tool. And Dr. Nithin Kochaar has shown us this path. I would say that it was a great session that we had. We express our sincere gratitude to Arya Vaidya Kalpashala as well as Fieldscraft for their continuous support and collaboration for promoting the Ayurveda education and research and holistic healthcare solutions. Finally, I would like to say that we are immensely grateful to Dr. Balchandra Mahamuni, one of the most dynamic and versatile doctors I have known so far, for creating this unique platform, that bridges this traditional gap we are having and integrating the Ayurveda wisdom with the contemporary medicine. Special thanks to our Dr. Datta sir, our in charge of Gurukul Global Academy, for constant support and your guidance for making this event successful. A very special thanks to all of you, all our participants who joined this session from 3 p.m. onwards, for your active engagement, thoughtful gestures, questions, and enthusiasm are made. I would like to believe that this session is interactive and enriching to all of us. I also acknowledge our technical support team, everyone involved in planning and execution of this event. And I would also like to tell all the participants to stay tuned for the further clinical meetings. You can connect to us through the WhatsApp group or any other social media platforms or through our websites. Finally, it's the Dhanteras or Dhantrayodashi today. We being Vaidyas to know the real meaning of it, as it's today the Lord Dhanvantari's Jayanti. Most of the people like to buy new things today, costly things, jewelries, gold, silver, etc. But it's our duty to remind our patient that Arogyam Dhana Sampada has been told to us by our forefathers and ancestors. Health is the real wealth. Finally, I would like to conclude this session with the shloka. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Karshit Dukkham Bhagave. Om Shanti Shanti Shanti. Wishing you all a very happy, healthy, and prosperous Diwali ahead. Thank you, one and all.
Thank you. Thank you very much. Thank you, Dr.
Thank
Datta.
you. Thank you, Kochaar sir, for
You're
giving
doing a great
us.
job. Doing a great job. If people join for the integrated course, I would be really happy. We can educate. Yeah. Wonderful.
We are happy to have you again, sir.
Yeah.
And thank you for making our Dhanvantari Jayanti so memorable and very memorable and knowledgeable.
Same here. Same for me also. Thank you very much. Thank you. Bye-bye.
Thank you. Thank you all. Thank you all the viewers and listeners. I conclude the session. The short remembrance for the next clinical meeting on the 6th of November. Please stay tuned. Thank you.
Thank you. Bye.